tried for the first time to analyze in a bone marrow transplantation patient what happens with the gut. And what you find is amazing. I'm sure you've seen some of the data, but the changes in the gut flora during transplant, you don't see that in any other setting. And you go from an Amazon rainforest, right, like your normal flora looks like, to sometimes either nothing or a single bacteria that has taken over the whole landscape of your gut.
But tell us about some of the associations that you teased out between gut composition and GVHD in that New England Journal paper.
Yeah, so the two major findings were, first of all, as I said already, you very quickly lose the diversity of your flora. And it's really fun by multiple factors, right? Because the first thing that we thought, it's probably the use of antibiotics, but it's much more than that. It's the change in diet, it's the chemotherapy, it is the radiation, it's all of the other drugs, right? We had another paper a couple of years later, which basically demonstrate that every drug has some impact on gut flora.
Sure.
Right? A transplant patient at any given moment is getting 6-7 different drugs for nausea, for pain, whatever. So that was an eye-opener that diversity mattered, and specifically patients who have a greater loss of their diversity within their gut flora, which happens very quickly, within a week or so, have worse outcomes. The outcomes were first and most of all lethal graft versus host. So it had direct impact on the overall outcomes of a transplant. That was one. The other thing, and I mentioned that already, is that in the change, in the loss of the diversity, there are certain bacteria that can start to dominate. And the one that does that more than anything else is Enterococcus. And what was really fascinating in that paper in the New England Journal, that we had patient data from 4 centers from all over the world, Japanese data, German data, US data, etc. And in all cases, in all settings, it didn't matter where it was Enterococcus that would do that more than any other bacteria. And that was, again, if that happened, if you reached a state of domination in your flora, your outcomes were, again, even worse, specifically increase in lethal graft versus host. So those were probably the two major findings. And then we had a whole bunch of follow-up studies where we looked at the mechanisms by which Enterococcus, that was actually a science paper, how that happened, right? Why does it lead to worse outcomes? So it was a fascinating story. And as I said already, it was really a journey like stuff that you had never thought of, right? I mean, I never thought about bacteria.
Yeah.
I was studying T cells and K cells. That was my business.